So thanks for coming along today. We're going to be talking about tackling inequalities really in Dundee. So two projects, as I said, working with DADx and YMCA Scotland and Newfield Medical Practice. There's basically two case studies, but they actually link into each other. Um, and both of these case studies work with men in deprived communities and new dads in deprived communities. Oops. Okay. So as I said, I'm going to be the MC. I'm going to do a little bit of provide you with a little bit of context around the subject, and then I'm going to hand over to Lisa Holder from DADx, who's going to talk about DADx's work in Tayside, and then I'm going to pass on to Pam Maelstrom from YMCA Tayside, who's going to talk about Elevate Men, and Jessica Moran, who's a social researcher. She's actually a member of our board and has done a huge amount of work with fathers, but she's done some research on Elevate Men. So she'll discuss what she found through that research project. And then at the end, there'll be an opportunity for questions and answers. So Colin McFarlane from YMCA Scotland will be joining us, Joe Good from Newfield Medical Group, and Fiona and Liam, who are the dads workers and the men's workers from DADx and YMCA Tayside. So before I kind of hand over to the projects, I thought it would be quite useful just to talk about men's health and why it's important to talk about it, why we should be talking about it. So I'm just going to provide you with a little bit of context. So in this section, I'm just going to talk a little bit about gender norms, a little bit about men's health seeking and unhealthy behaviours. So first off, I thought it would be useful just to start with some of our statistics in Scotland. In 2024, there was 518 men died of suicide in Scotland. And as we all know, the rate of suicide in men is much higher than women. So there are three times the number of men who lose their life through suicide each year compared to women in Scotland. In terms of substance misuse, men are 3 times more likely to report frequent drug use and become dependent on alcohol. And in terms of health-seeking behaviour, men are far less likely to seek help. Only 36% of referrals to NHS talking treatments are from men. So this is just to give you a kind of broad brush of some of the health inequalities that men face in Scotland at the moment. And there are serious consequences, actually. So going back to societal and gender norms, some of the reasons why there is this inequality is that there are substantial differences or substantial issues around societal and gender norms. Now, when we talk about societal and gender norms, we're talking about and obviously these are broad brushstrokes and there's lots of differences, but these are sort of generalities, that there are accepted ideas of how women and men should act within a specific society or community. So it's how men tend to act within the world and what men and what society expects from men. Now, there are obviously some fairly different, big differences between groups within a particular country. So there may be really significant differences between men in very affluent areas and men from more deprived areas within the same culture, and then obviously from culture to culture. So, men within Scotland and men within, say, South Africa or South America or wherever it might be, might have very different societal gender norms. These are often learned in early life through a process of gender socialization, which sets common standards and expectations to which girls and boys and later women and men should conform. So these gender norms are set early on in life. So often we find that as men grow up, boys define themselves in large part in terms of the differences of their differences from girls. So for many boys in Scotland, for example, they are expected to be hard and cool and competitive and avoid showing any weakness. Those who are seen as failing to live up to their dominant norms, so these kind of being hard, being cool, are often criticised and ridiculed for crossing these boundaries. Um, so as men grow up, some subscribe to these gender norms to different extents. So some go on with these gender norms, and some of them reject them completely. So in terms of these gender norms, they can sort of often be described or come out through traditional attributes and behaviours that society expects from men. As I said, these change from culture to culture, and not all men are the same. But these are some of the kind of prevalent, kind of gold standard attributes and behaviours that we can see in men. So, and what society expects from men. So, society and men often themselves measure up against the fact that they are powerful, they're independent, they're efficient, they're rational, they're competitive, successful, and in control. And very importantly, for this conversation, they're never vulnerable. And that lack of vulnerability, or that not showing your emotion, not showing that you're vulnerable, often comes out through stoicism. And I really like this image, although I kind of think that it's now pretty old-fashioned. But this is obviously um, a, 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 a kind of archetype of male stoicism, of that kind of gunslinging um, guy out in the Wild West. Who's enduring pain and hardship with any of this kind of feelings of complaint. You don't kind of imagine imagine this kind of character to complain about what's going on around about him. And this kind of stoicism is associated with um, sort of phrases like, you just have to man up. Boys don't cry. Play through the pain. Just take it like a man. Don't let them see you sweat. So this idea that you have to cope by yourself, not show any vulnerability, is a very male archetype around stoicism. And this, we can kind of see this through some of these statistics that I've already talked about. Uh, and one example is that men aged between 20 and 40 are half as likely to go to their GP as women of the same age. And there are differences between the way that men and women seek support. So oftentimes, and this is again not all the time, but oftentimes when depressed or anxious or unable to cope, women will tend to respond with behaviors that promote sympathy and comfort. So they might phone a friend and ask for advice or support. They might cry, and then through crying, they'll receive comfort and reassurance and be able to talk through their problems. Men, on the other hand, are far more likely to avoid sympathy and comfort. Going back to those kind of archetypal, I've got to be strong. If I'm not seen as strong, then I'm vulnerable and weak, and so on and so forth. So men tend to avoid sympathy and comfort from others, and will respond with behaviours that will promote distancing. So they'll step away from the sources of support often. And if left unchecked, this can create a buildup of distress, coupled with difficulties admitting to a problem or seeking help. And ultimately, if we leave this unchecked, then it can culminate in crisis and breakdown. And again, so if we leave these emotional issues unchecked through denying or avoiding underlying emotions like fear and sadness and shame and defeat, they can result in really unhealthy behavior. So men often will self-medicate more using alcohol or substance use. Men can overcommit to work. So if there's tension at home, they'll stay away and stay within the work environment rather than go into the family home. They're far more likely to get involved in gambling or risk taking as a way of solving their problems or escaping from their problems. They're more likely to get involved in infidelity, um, and very importantly, actually, in terms of unhealthy behaviours, this can come across in anger and violence towards others and themselves, actually. Often these behaviours cluster together and they're often linked to deprivation and social exclusion. So the next thing I'm going to do is just talk a little bit about the impact of fatherhood. Um, Now, there are some really, I don't have very much time to talk about this in depth, but there are some real risks associated with becoming a father around poor mental health. Uh, Becoming a dad is one of the most significant life events that any man can go through. And it shifts, there are some fairly fundamental shifts in lifestyle, obviously, as you're bringing a baby into the world. Um, Family lifestyles and family dynamics change enormously. You've got another mouth to feed. Um, Dads often find that they lose their support structure and they lose their sense of identity at this point of time. And so, um, although often the media portrays becoming a parent as this wonderful time, joyful time, often for many men like women, it can be a time where there's a real high risk of poor mental health. And we can see from the statistics that that dads or new dads are twice as likely to become depressed in the first year after becoming a dad than the general population. Between 8 and 26% of men experience paternal perinatal depression, and this peaks around 3 to 6 months after the birth. So there's a slight pause, and you get this once things have returned to normal after the baby's arrived. You'll then see, and the pressure of having a newborn increases. You see this peak at 3 to 6 months, and paternal perinatal depression rises to between 25 and 50% in men whose partners are experiencing postnatal depression. So if mum is really struggling with poor mental health, then dad is far more likely to be experiencing paternal perinatal depression as well. So these things are interdependent. And this is a piece of research that came out last year, I think, from Wales, that estimates that between 2 and 3 babies every week lose their fathers to suicide across the UK. So it's really significant numbers, and there's a real issue of risk around that transition into fatherhood. However, this period of change and fatherhood can offer some real positive opportunities as well. Becoming as a dad, as I said, is one of the most significant life events that a man can go through, and it can provide an amazing opportunity for positive psychological growth and maturation. It can be a chance for men to become far more sensitive, calm, harmonious, patient, humble, and less self-centered. So if they're very involved in the care of their child, their personalities can change and do change actually as a result of that process. And it also provides a golden opportunity for men to reassess their lifestyles, their unhealthy behaviors in order to prioritize their family and to be the best dad that they can possibly be for their child. So I'm bringing it back to men's health in Dundee. And I suppose, why Dundee? Why are we focusing on Dundee? Well, Dundee has one of the worst health inequality profiles in Scotland. It's ranked fifth most deprived local authority in Scotland. I think there's about 36 local authorities in Scotland. Male life expectancy is 2 to 3 years lower than the Scottish average. Around 2,500 young or men between the ages of 15 and 64 are using drugs in Dundee. 70% are men. And Dundee's men are more than twice as likely to have a drug misuse death than women. And sadly, Dundee has the second highest mortality rate from suicide in Scotland, and 72% of those were men. So in order to support men in poverty and make healthy choices, it's crucial to prevent the compounding effects of deprivation, which drive health inequalities and tragic death. And fatherhood can provide a piece of that puzzle, can be a turning point for change. It can provide men with the drive necessary to make healthier choices. But the other fork in that particular road is it can cause poor mental health and increase unhealthy behaviours. So I'm going to hand over to Lisa from DADrock in a minute, just to talk about her work in Dundee, or DADrock's work in Dundee, who are working with some of these new dads in the Dundee area, and what sort of difference it makes to those dads. So I'm going to stop sharing now, and hopefully, Lisa can share her screen. Let's see how that goes. Or Connor is going to share Lisa's. Is that okay? Can everybody see that all right?
Great. Thanks, Kathy. Hi, I'm Lisa, as Kathy said, from DADrock. Recently became director, although I've actually been at DADrock for the last 8 years. Could you go to the first slide, please, Connor? So basically, DADrock sees a world where every child grows up with the best possible version of their family. We actually work across, so we started in Edinburgh, we work in Glasgow. Andy's on the call as well. We also work across North Ayrshire, just started in East Ayrshire, and obviously Dundee as well. It was actually set up by two dads back in 2012. They wanted to do more with their kids, but couldn't find anything that wasn't, with toddler groups full of mums and things like that. So they actually set up the first play group for DADrock, and it had 12 dads come along on that first session. And we now support over 4,000 people each year. So we do this by providing bespoke one-to-one support with dedicated dads workers. We have playgroups in each of the areas that we work for dads and their children. We do antenatal and other parenting workshops in those areas and online. And we also have perinatal peer support, which is trained volunteers. And it's all online, so that anyone from across Scotland can access that service and be referred to that service. So the reason that we wanted to start working in Dundee was because, there was clear evidence, as Kathy has actually just eloquently put, that we should start working in Dundee. And with support from Donna Bra, who was the senior midwife in 9 Wells at the time, but she's now moved to Forth Valley, we put together a funding proposal and got Child Poverty Practice Accelerator Fund grant to start working in Dundee, which was great. Next slide, please. Thank you. So basically what we've been doing is Fiona came on board to help lead our work in Dundee, and we've been working with partners across Tayside to provide person-centred, individualised care for families needing additional support with parenting. So we have already had around 60 families who have signed up to some sort of DADrock activity from Dundee. And we have 32 active in our WhatsApp group, which is like a peer support group. We have a big DADrock WhatsApp community, and within it there's lots of area groups. So one for Dundee, one for Edinburgh, and so on. And then there's also groups that focus on different things like cooking and gaming and fishing and all sorts of things. So it's a really good opportunity for dads to sort of talk about non-parenting things as well as parenting things, and sort of build up a community that really support each other. And this is the first project in Dundee offering specific support for dads. So, as I said, we have dad's playgroups. These are at the Boomerang Centre at 10 a.m. every Saturday. We've had a total of 13 different dads come, along with 15 children. The youngest attendee was 10 days old, which is so cute. And dads are attending on a regular basis, which is really good. There's more information there on our website if you wanted to have a look at what we're up to. We also organise trips and outings because it's a great opportunity for dads to do something different with their children. We've had some fire station visits so far, and we're also planning a lovely summer barbecue for the dad's Father's Day. I mentioned that we also do workshops, free antenatal workshops for dads. The first session took place with 4 dads. And then our most recent class in March, we had 16 dads sign up, but 12 came along, which is still a great number to have in one session. Well, our next sessions are on the 29th of April, so just tomorrow. And then another one is due for June the 10th. So any dads you know that need to come along to that, just get them to sign up. Fiona as well offers one-to-one support. So this can be referrals from health visitors, any other sort of professionals that work with families and feel that the dad needs a bit of extra support. In 6 months, we've worked with over 25 families, building trusted relationships with them, listening to what they need, and it's very much bespoke support. So it would depend on, whether they needed support with maximising income, housing, childcare, mental health, obviously parenting, and anything else that really Fiona can help them with. We've also been building up and strengthening sort of local agency networks to help dads in Tayside, joining up with other organisations. And Fiona's been invited to a wider network of statutory and third sector organisations, including GPs, who are now referring to Dad's Rock as well. As well as that, obviously, lots of third sector partners, just trying to spread the word, really, taking our leaflets out and making sure that people know about us. And we've had some great support from local shops and things like that as well, who have been able to give us healthy snacks and food we can pass on to the families that we're working with. I just wanted to sort of finish off with some really good feedback that we've had from various places. So Dundee said, every time I see you, you give me homework, but it's all been so informative, and feel I'm getting more prepared for when I get my daughter. I don't feel so anxious about it now. And then we obviously have had a referral from someone from the yard in Dundee who said some of our dads attend your playgroups. They have found it beneficial. We've had some more dads that would benefit from Dad's Rock. It's badly needed. And then finally, we had a really great Google review from a dad that came along to our antenatal workshop who said it was incredibly informative, full of energy, information, and also laughs. Fiona answered all the questions asked by us, and no question was too silly or too much for her. I've signed up for the WhatsApp group and will certainly be taking advantage of the other services that this charity offers. Highly recommend any pending dads to sign off. So really that's a little snapshot of what Dad's Rock has been up to in Dundee. And yeah, thanks to Fiona for all of her hard work getting that all up and running.
That's great. Thanks, Lisa. I'm just going to share my slides again. Yeah, and I have to say as well with Lisa and Dad's Rock, there really is a dearth of kind of dad specific support up in Dundee. It's really filling a hole. So obviously Homestart Dundee used to operate in the area and did some dad's work, and that's now closed down. I know that Boomerang tried to set up a dad's group up in Dundee previously, but there really is a kind of a dad shaped hole up in Dundee, and it's so lovely actually that Dad's Rock can go up and fill that hole. And I know that we'll come on to this a little bit later on, but they've really only been working up in Dundee for a year, and it's really starting to gain traction. And anybody who's tried to set up a dad's group or work with dads knows that it's no easy task actually, and they're just starting to get a bit of momentum and get really busy up in Dundee, and it's really heartening to see. So thanks ever so much, Lisa, and there'll be a chance to talk to Lisa and to Fiona, the dad's worker, at the end of the event. Oops, there we go. So the next bit of the presentation is about Elevate Men in Whitfield and Dundee. And Fathers Network Scotland, we've been working with Dad's Rock up in Dundee, but we've also recently been working with YMCA Scotland and YMCA Tayside specifically. But we're kind of very new to this, I have to say. So we've only really been working with YMCA in the last few weeks, really, I suppose, last 3 months specifically. And I was just absolutely blown away by what's happening in Newfield up in the Crescent. So the image that you can see is the Crescent up in Whitfield, and Whitfield is an area of Dundee. It's quite far from the city centre. Um, Historically, it's been an area of really high deprivation. And I know I went up to deliver some training up there recently, and I was really surprised actually about the number of new builds and the level of kind of, I suppose, sort of new building and sort of uh, yeah, just kind of regeneration in the area. It's really, I was expecting it to be um, seem much higher deprivation, but actually it's the community. I think the local authority has spent an awful lot of money trying to support this area and develop this area. And the Crescent is part of that initiative. Um, and I just wanted to talk a little bit about how unusual Newfield Medical Group is. So it's based within this crescent. Um, and it was established back in 2022. Normally, GP practices, so the GP practice sits on the first floor of the crescent. And normally, GP practices are either privately run by individuals or they're run by the NHS. And in 2022, the GPs within this practice made quite a bold decision actually to become a cooperative, which is really unusual. In fact, I don't think that there are any other cooperatives in Scotland. I don't know whether there's any in the rest of the UK. It's very, very unusual for GP practices to be set up this way. And it allows for the practice to operate far more fluidly. They can respond to the needs of their the community that they serve far more easily than they could do within normal structures or the normal constraints of NHS. And it's allowed them to do all sorts of really interesting projects. So they have an area of their practice where they support new GPs coming in from Ninewell. So part of their students is that or GPs student practice is that they have to go and work with GPs, and Newfield facilitates that. They work alongside local authorities much better. They serve their community in all sorts of different ways, which is really unique and interesting. But one thing that they saw, which was an area where they wanted to grow, was that they wanted to work far more closely with the third sector. And so Newfield Medical Group was set up as a cooperative in 2022, and it meant that any of the profits from the GP practice went back in into the medical practice. But in 2023, they decided to set up a charitable arm of the medical group, and that was called Newfield Community Group. And I'm just going to move my slides on. So the Newfield Community Group, which is kind of like a side arm of Newfield Medical Group, the focus of that charity was to advance and support and improve the help of local populations in one of Dundee's most deprived addresses in Scotland. And they did it in two quite simple ways in a way. They wanted to establish a physical community space within the practice. So there's a community cafe on the ground floor that anybody can access from the community. And they also want it to be a home for local third sector agencies. Now, this is a really, really new initiative. It was just set up in 2023. And as you can see, they're already working with a huge number of agencies. So agencies, third sector agencies, providing addiction support and recovery services, mental health support, welfare support, mother and baby support groups, organizations tackling loneliness, accessibility to appointments, so on and so forth. So you can see all of these third sector organizations, the GP practice are kind of embedded with. And what's really great about Newfield particularly is the GP practices they run a vulnerable access clinic. So those in the community who are really need help urgently can immediately speak to a GP. So they can come in off the street and they'll talk to a GP almost immediately. And those GPs can then refer individuals literally downstairs into a community cafe where there are third sector organizations already interface within that community group. And YMCA Tayside offers one of those support groups that operates within that building and in partnership with Newfield Community Group. And that's what I'm going to hand over to Pam to tell you a little bit more about Elevate Men and how Elevate Men developed and their partnership with Newfield. So there we go. So I'm just wondering, I might just stop sharing and Connor, can you pin Pam so people can see Pam? Thanks very much. So I'm just going to hand over to Pam from YMCA Tayside.
Good morning. So just to track back a bit in time, so YMCA Tayside, we are based in city centre Perth as our main location where I am, but we have projects predominantly with young people across Tayside, and Dundee being one of those locations. And 2 years ago, we had funding to start a kind of scoping project, particularly targeting young men and mental health, and who were experiencing poor mental health. And so our worker, Liam, who you will hear us talk about many times, and he will be part of the Q&A, was the lead on that project. And initially, there was just kind of a comprehensive scoping out project about what services were available in Dundee for young men, and who's accessing it and what were the gaps in services. And out of the back of that, we developed engagement, particularly with the asylum seeker community, and particularly through Mears Housing. We worked with them and developed a network where multiple agencies, but quite often the job centre were quite a big referrer into what became known as the Elevate project. And our worker Liam he would be in Dundee approximately 2 days a week, would meet with individuals and groups, and sort of started this to build momentum, particularly with young men around physical activity, as well as finding their strengths, increasing this like hopefulness that they didn't seem to experience, but also there was a big part was about establishing a routine, and it became clear that our goal initially was that we would just set up groups and we would work with young men in groups, but actually it became clear that men needed so much pre-work before they could access groups. But as the sort of 2-year pilot, it was a 1 year, it got extended to a 2-year project. As that developed, we also then were looking for more permanent locations to base the projects. One of those was a local organisation called Showcases Street, and Scrap Antics, both of which we worked really closely with their staff to develop different aspects of the project, but a core part of it always remained physical activity, and motivational interviewing and goal setting have kind of been the core parts of the project. But throughout time, we didn't have a permanent location. And towards the end of last year, Liam met one of the GPs, Rebecca, who was looking to they were looking at establishing the VAC clinic and looking for third sector organisations to be part of it. And a key kind of demographic that they wanted to support was particularly young men. And so the Elevate project started to come online and on board with the work in the VAC clinic. So the VAC, we call it VAC clinic, the Vulnerable Access Clinic happens on a Monday. And it happens specifically on a Monday because often people experience crisis. Now, the VAC clinic is open, my understanding, sorry, I speak as if I know I'm not there, but my understanding is that it's for anybody who's experiencing crisis, be that with their physical health, addictions, mental health, that, it's not one specific thing, but people in crisis, and it could be complex, multiple vulnerabilities, that if they are experiencing crisis over a weekend, they need immediate support, or if they end up in being hospitalised or seeking treatment another way, they need immediate support. They're more likely to then continue with support if it's on the Monday. And so that's when the VAC clinic ends. And really our work is in parallel now with what happens at the surgery and the GPs. So Liam and potentially one other worker are based within the VAC clinic, and GPs refer to Liam and the team from YMCA that are based there. And they do a number of things. So one is there's a big emphasis still on one-to-one work with young men, and it's one of the things that we learned over the course of the first 2 years was that actually we generally in our work with YMCA work with young men up till about the age of 25, but actually there was a lot of young men that needed support that were older than that. So we've opened up kind of who we will work with, and it tends to be a mix of one-to-ones or group work support. And there's 2 lots of group works over a Monday and a Tuesday. That one is physical activity and one is about peer mentoring, support, motivation. Everybody who comes to the clinic gets an initial kind of consultation, and they fill out a questionnaire that asks them specifically about fatherhood, about gambling, about alcohol or addictions. You support family histories or things that are going on in their world, alongside what goals would they like to achieve. And actually a big part of one of the group work sessions that happen is helping young men particularly look at what are their goals, what are the things that are immediately important or that they would like to see happen, that would see change in their lives, that go alongside maybe the clinical intervention. And it's that we take it's a big emphasis on relationship building alongside activity, alongside us looking to the future. They're the kind of 3 key core parts, and Liam spends a lot of time messaging, calling, picking up, developing relationship with the men so that they can start to develop healthy routines as part of the project. This project still feels that it's evolving in how that we can work together well with the GP practice in a non-clinical youth work approach to supporting men in all aspects of their life. So that's kind of essentially how the project works. We got funding recently through the Alliance to continue this work, but specifically look at research of the impact. And Jessica's going to fill you in about how that research happened and kind of the highlights of that story.
So I'm just going to share my slides just now again, hopefully, and bring Jessica in. So Jessica is a a social researcher who has a speciality in men and dads, and is also, we're really lucky that she's part of our board as well. And as Pamela mentioned, we've we've just been working with YMCA Tayside for just a very short few months. And part of that activity was around evaluating and understanding the impact of this work. And I'm going to just pass over to Jessica now, hopefully, to tell you a little bit more. So, Jessica, if you're
Hello,
ready.
I am. Can you hear me? I don't have my headphones on.
Yeah, can hear you loud and clear.
Great. Fantastic. Thank you so much. So, thanks everybody for joining us today. My name is Jessica Moran. I'm an independent social researcher and have worked with Fathers Network Scotland for a long time, over a decade. That was really brilliantly useful, Pam, to have that background to Elevate, because I didn't include a lot of that. So that is really helpful for underpinning the evaluation and the process to understand more about Elevate. So in the last few months, we've undergone this rapid evaluation for the Elevate program, and it was quite a short period of time. So, in order to get started, we met up as a project team, and these are some of the kind of stages that we've gone through to get to where we are. And we just discussed the amount of time we had, the capacity and the scope of the evaluation, and what we would like to do. I developed some research questions, which I'll go to in a second. And ultimately, what we came up with for the evaluation was to look at the existing questionnaire that Pam had just mentioned, that everybody goes through when they're coming into the program, and to augment that by adding some questions to it from something called the Gambling Harm Severity Index, and then to conduct a focus group with five of the men who regularly attend. That's such a Freudian slip. I'm so used to talking about dads. Yeah, one thing maybe to point out before we get started is obviously today we're talking about dads and inequality. I know that two of the men who took part in the focus group are dads, not all of them are, but the issues that are affecting them are obviously very similar and overlapping, the dads and the men in the project. So next slide, please. Thank you. So just to tell you about the research questions that we were looking to answer with the evaluation, we had two key research questions. Has the Elevate project been effective at improving well-being for the participants? And if so, then in what ways? And then secondly, looking at the gambling harm aspect, are the participants in Elevate at risk from gambling harm, and what would be the prevalence and severity of that risk? So as I mentioned before, in order to look at gambling harms, we use something called the Gambling Harm Severity Index, which is a validated tool. It's 3 questions which look at gambling related harms over the domains of mood and feelings, day-to-day finances, and effects on family and loved ones. So we use those methods. I'm going to go through some of the key findings that we had. We obviously have a much longer and more in-depth research report, which will be available soon. But I'm just going to pick out some of the key areas that we found from our focus group, and then touch briefly on the gambling harms results that we looked at. Next slide, please. So very much as Pam was saying, one of the key things that came up in the focus group was this sense of kind of purposefulness to the weekly meetings with Elevate. So as Pam described, the men who attend talked about attending the fitness sessions and having the one-to-one support from Liam. And the key things that came out was that gave them just a sense of purpose and a sense of meaning. So just to be clear as well, obviously all the participants' names have been changed. These are pseudonyms. But David has said, like, a purpose, a sense of purpose. You've got something to do, something to focus on, to work towards, and you've got it coming up. And that kind of sense of accountability and purpose really underpinned people's progress. I think something that came up as well a lot with the fitness sessions was definitely that they found them very accessible. So people talked about maybe feeling intimidated to go into a kind of gym or like a boxing gym in another setting, but actually they're saying, as Sean is saying here, definitely the atmosphere being, it's not as daunting. So if you went into a local boxing club, maybe you'd be thinking they'd be like, why is this 37-year-old guy here? But actually, they're feeling very at home in the Elevate sessions and the fitness sessions that Liam is running. Next slide, please. So yeah, as you mentioned before, Pam, the structure and goal setting was absolutely huge for their participants. So they highlighted a lot around goals and how Liam helped work with them to set realistic goals that were tailored to their life circumstances and challenges, and talked a lot about how the accountability of having the goals to meet and also having meetings booked in to discuss them helped them maintain their motivation. So Brian has said, we're all here to try and improve our lives. Basically, I think it's really important, again, just the fact that you're turning up, so you're wanting the help's there. And like another participant has said, Liam, no matter what it is, he'll set that structure out for you. He'll go, right, okay, I'll research it. I'll give you this information. Go and do it. So the goal setting structure was really highly praised by the participants in the focus group. And the other thing that was mentioned as well was that the goals that are being set are achievable. So they're not things that are overwhelming people and making them feel like, oh, I can never cope. I'm not going to be able to make this. They know that they're able to fulfill at least some of the goals that they've set for themselves, and that keeps their motivation going. Next slide, please. Peer support. A big theme in the focus group was the peer support aspect. So the group that we were talking to in the focus group, they had a lot of shared lived experience of addiction, mental health difficulties, and they talked a lot about how that made them feel like, we're all kind of working towards the same thing, we're all in the same boat, and reduced a sense of stigma or judgment that they might have had coming into that situation. So as Sean said, it's good, everyone's in the same boat, roughly kind of what problems or stuff like that. I've got the same or that. So you're not the only person on a group who's got some drug or alcohol or mental health problems, and that makes a difference. I think the sense of kind of solidarity and sharing experience was really tangible sitting in the focus group, and you can tell that relationships and friendships are being developed, within the group setting that are supporting the men who are attending in their journeys. Next slide, please. So, personal motivation. There were a lot of stories of how Elevate had impacted on the men who were taking part, a lot around their kind of personal motivation, a lot around improved fitness and meeting goals. But I picked this quote because it was really impactful, and I think, the whole group kind of felt it when the participant Jamie had said, there's been a big improvement 90% of the time when I was working for my dad before I would even get out of my bed. He described, like, I wake up, my head's right back down. But the fact that he'd been turning up for work, he said, it's massive. I've been making sure that I go and do the things I need to do. And then talking about Liam, he says he's realistic about it as well. Like he'll say, maybe write out a few goals at the start of the week. And he says even he doesn't get through all his goals. But as long as you've crossed off a few of them, you've done something. And I think this is a really great demonstration of the kind of relationship that's obviously been developed with Liam and the men who are being supported, because they kind of feel like, even Liam isn't perfect, he doesn't always get everything done. But the goals that he's meeting, they're giving them the sense of motivation to keep moving forward. And that was a really positive story there. Next slide, please. So gambling harms. We spent a fair bit of time at the end of our focus group discussing gambling harms, and I was quite surprised at the level of prevalence in the group. Everybody had a story that they'd been affected either personally or within their family. Definitely gambling was viewed as kind of comparable to other addictions, and the impulsivity that was driving gambling was viewed as being related as well to being under the influence of drugs or alcohol. A number of harms were discussed, financial losses, impact on relationships, impact on housing stability, and also job security. And one of the participants, who was a dad, had said, my partner, she's banned me off about 12 gambling sites already just before Christmas. I was always putting in 10, 20 quid. I was winning money back, but I wasn't keeping tabs on how much I was putting in. And before Christmas, I put in 370 quid and pulled down 60 quid. So that conversation kind of developed into talking about like having that financial loss just before Christmas was quite impactful for his family. And as a dad with several kids, it created a difficult situation for him. So the gambling harms definitely showed a wide prevalence for that group. And I think the next slide will be looking at the survey results. So this is quite dense, and I don't think we've got loads of time to go through each individual pie chart, but essentially we asked 3 questions of the new participants who were joining the Elevate group within that period. So it was looking at February and March. I think it was about a 6-week period. And so there isn't a large number of responses to this. So we had 5 men who filled in the questionnaire within that time. So it is a small sample. But even just looking at the first graph there, which, my indicators have moved a little bit. But essentially, we asked over the last 3 months in relation to gambling, how often have you noticed changes in your mood or feelings, feeling down, shameful or anxious? And it's not maybe clear there, but 80% of those 5 men said that yes, they had felt that frequently. And one person said that they'd felt it sometimes. So even just looking at that, you see that everybody's been affected by it in that small group, and that some people are being affected by it a lot. The other results, I think for the sake of time, I will let you look at them in the report. But essentially, although that is a very small sample, everybody who was joining within that period had been affected by gambling harms, mostly in terms of mood and feelings, but also in finances and how it's affecting their relationships. Next slide, please. Thanks. So to wrap up, I'm conscious of time. We found from the focus group that the Elevate project shows a lot of evidence that it's been effective at improving the well-being of participants. People mentioned structure, motivation, their sense of purpose, and the support system. There was a lot of evidence of it helping individuals to recover from setbacks and build healthier habits, feel more hopeful, develop positive relationships within their social circle. As we mentioned before, we definitely found that gambling harms were common within the study group, and that the findings indicated that the people who are joining Elevate are likely to be affected by gambling harms. Obviously, we had a very small sample for the survey responses, and it was a small group for the focus group, but if the data is representative, the harms are likely to be extensive within this group. Just to mention as well that the evidence showed from the focus group that the partnership with Newfield Medical Group has really supported and facilitated the programme in a really effective way, as we talked before about the referral route. And the main feedback from the men who took part was that they just want to have more of this programme. They just want it to be expanded. Obviously, for that to happen, they would have to have enhanced delivery capability and more staffing, because sadly, there's only one Liam. So yeah, and just to say finally, thank you. I think my last slide is just a thanks. Well, I will just say thank you. Thank you very much to Becky, who I know couldn't be with us, but Becky Forrester at Newfield, and Liam and Pam. So thank you for your contributions to that report, and it will be available in full, so you can take a closer look. Thank you.
Thanks so much, Jessica. And as I said, our work with Elevate and Newfield is relatively new. We've only been working with them for 3 months, and Jessica has really pulled out all the stops to not only go up and carry out a focus group with the men that were working with Liam, but also to write all that up in such a short space of time. And just a huge thank you to Liam, and I think it's probably testament to Liam actually that Liam was able to gather 5 guys together in a room to support this piece of work, and they're really willing to talk about quite openly about some of the issues that they faced, and be really open and honest about some of the struggles that they'd had personally. So it's an enormous testament to Liam and the work of YMCA that they were able to do that piece of work and work with us so quickly to get this piece of work out. So massive thanks to Jessica and Liam and Pam and Newfield as well for hosting all of this work in order for us to get it through. I thought it would be, as Jessica said, it's quite a small sample size from the Elevate Men questionnaire that we changed within that 3-month period. But of the men who participated in this updated questionnaire, 5 of those evaluations, 4 of those men had children, and 1 of them would like to have a child in the next 5 years. So you can really see actually that fatherhood and men within those, or fatherhood, is a really prolific or prevalent issue. And this is a response from one of the participants in the Elevate who participated in this Elevate questionnaire, and you can really see how important their family and in this case this guy's daughter is to them. So he was saying, who are the most important people in your life? My daughter and my immediate family. And what are some of the past successes you're proud of? And for this guy, it's seeing his daughter. So he'd overcome some of his addictions in order that he was able to access his daughter. And some of the activities or some of the actions for him, some of the things that he wanted to achieve was get some money, keep my court order for my baby, and to get sober. So you can really see just from that one example of how important family life and children can be in motivating more healthy behaviours for some of the participants. So I'm going to stop sharing now and kind of hand over not only to Lisa and to Pam, who you've heard about, and Jessica, who's done this fantastic piece of research, but also to Joe Good, who works for Newfield Medical Group and coordinates all of these third sector organisations, including Elevate Men, but also Fiona Harrow, who's the dad's worker for Dad's Rock up in Dundee, and to Liam, who we've heard a lot about, who's the youth worker up at YMCA. So I'm going to stop sharing just now. But if you've got any questions, either put your hand up, or if you could put it into the text box at the side, and we'll see whether we can get some of those questions into that panel. But I'm going to kick off, actually. I've got 2 questions. So my first question is to Liam. So Liam, we've heard lots about you. You might have to unmute yourself in a second. But we've heard lots about you. But it's really quite an unusual partnership that YMCA Tayside has with the medical centre. What's it really like being involved, so closely involved with the GP practice, and how do you think that kind of closeness helps you or hinders your work with young men?
So it definitely helps, and it's not just young men, so it's men up. There's no age limit with the guys I work with up here. But I guess, working from the clinic, it's comfort zone. So they refer the guys, and very shortly after, I'll see them in the same place that they've been referred from. And the clinic here is so good. They see so many men. The referrals are just endless. Each week, I think, the referrals will get less, but it's not been the case thus far. So I'm always trying to adapt and meet the needs of the guys. So currently I'm working on trying to put in loads of different workshops to run from our cafe here. So if anybody on here runs workshops and they're looking for places to deliver it, do get in touch. yeah, the more support we can offer, I think, the better.
Excellent. And I mean, I suppose it's quite unusual for you because you will know the staff at the GP practice really well and be able to do you have kind of regular catch ups with the GP staff?
Yeah, all the time. So there's key GP staff. So the kind of lead doctor on up here is Dr. Forrester. And she's just really passionate about it. She volunteers a lot of her time to kind of support the community group. So yeah, a lot of contact, which is great.
Excellent. And Joe, I'm just wondering whether Joe Good, who runs the sort of community wing, whether Joe, you'd like to just have a talk about what it's like hosting, if you're around. I don't
Yeah,
know
can
whether I
you
can
hear
see you.
me?
Oh, hi, Joe.
Yeah, here. Hello. Yeah, it's good. A lot of like a couple of constraints that we have here is space. It's amazing having as much support up here. Like a lot of local people say, a lot of the time they have to get a number of buses or expensive taxis or whatever to get to the support that they need. So it's nice to be able to offer all that sort of up in this end of the city. We're hoping that we're going to expand our cafe space as well. So hopefully shortly we'll have much more space to offer much more. But yeah, it's good. It's busy. I think Whitfield as well has always had um, things taken away. There's been community hubs that have been set up and then like they've stopped, and I think quite a lot of local people and like all the stuff that is happening in the cafe side run by volunteers, and I think they really appreciate having somewhere that we're not going anywhere anytime soon. We're here. They're stuck with us. I'm afraid they're stuck with my face every day if they pop in. That's just yeah. So yeah, it's good. It's busy. It's good.
And do you, I mean, I suppose you're kind of, in some respects, you're kind of like you help network people who are accessing the GP's clinics and accessing or coming in and using the cafe, which is free to use, so people
Yeah.
don't have to pay. You're kind of there to help find the right services for the people that are accessing. And how does that? It's kind of like a dating agency or something. It's like, finding the right resource for those particular people. And also, does it inform the third sector organizations that you want to get involved with the space as well?
Yeah, I mean, it definitely is a bit like a dating agency sometimes. Sometimes, if it's well-known things like housing, I think great, that's fine. I know exactly where to signpost people to. But when it comes sort of more complex and things, I'm a bit like, oh, I don't know where we can do that. But there's always something. There's always one way or another to get around it. I'll walk past reception up the stairs all the time, and they're always like, where can we refer somebody that's experiencing this? And I sometimes feel like one of the GPs always calls me their yellow pages, which I'm just like, yeah, I don't know where it all comes, or where all the information comes from, but yeah, there's always a way of finding something for somebody, and quite a lot of the time, most of the time actually, a lot of the support services that people up here are needing are already coming in, or if they're not coming into our community cafe, they're in the area anyways. So it's quite good to be able to signpost, even if it's just along in Fintry or for benefit support down at the new school. Like there's always something in the area that they can access. So yeah, it's good.
Awesome. It's been quite gratifying, I suppose, for us as an organization being able to I suppose bring Dad's Rock and bring Fiona's work into Newfield as well, which is kind of and and I suppose Liam talked about the fact that he's really oversubscribed actually. So the number of men that are getting referred onto him for support, he's just not able to cope with the numbers. So being able for him to be able to now work with Fiona from Dad's Rock actually was like a bit of an unforeseen benefit actually. But I'm just wondering whether we can bring Fiona in just to talk about, because Fiona and Dad Rock, I suppose, you know, again, it's quite a new initiative, and it's fair to say that it was quite hard to get going at the beginning of your time, but you seem to have accelerated, and it's been a real catalyst for change. So, I suppose my first question for you, Fiona, is what's it like working up in Newfield? And also, I want to ask about just what you think that catalyst is for change has been recently, where you've seen this kind of you've become far busier, I suppose.
With working with Newfield's been great. I've had several referrals from Liam, and all the referrals from him have been going very well. I think the dads have been getting quite a lot out of it, and I still see them on a weekly basis. The catalyst for change, I think, between Dad's Rock social media, which is absolutely fantastic, and the Courier doing a piece in the Courier doing a piece in the paper about the antenatal workshop that we did, really helped boost things along. And the networking events that I go to really help other third-party organisations really open the door for us as well. So I've been getting referrals from all over. I got a referral this morning from a school. So, you know, it's all happening. It's getting busier all the time.
It takes a little bit of time. You need to know lots of Joes as well,
Yeah.
who can help. You know, it is all about that kind of constellation of third sector organisations and universal services, actually, who know what's out there and you can kind of support each other, so you're getting the right fit for each individual. That's great to hear. Kirsty, you've been very patient. Have your hand up for ages. Do you want to? What's your question?
Yeah, thanks, Kathy. So I manage a research trial that's looking, well, first of all, just thank you to everyone. It's been great to hear about all the fantastic work that's supporting dads in Dundee and Tayside. So I manage a trial that's looking at an infant parent mental health support that's delivered by lived experience practitioners that has clinical oversight. And I guess, I mean, I don't even know really what my question is, which is kind of indicative of some of the challenges that we're facing. Because I guess I'm curious about the sort of step before Newfield, the creation of Newfield and all of the kind of services that are working together, because we're finding it's quite that sort of back office bit, the stuff around kind of governance, navigating the funding streams to think about where our intervention might fit is really challenging, that sort of because it kind of overlaps between health and social care. So I guess, like I say, I'm not sure necessarily what my question is, but I guess I'm curious about the experience of setting up, particularly the kind of Newfield, the community Newfield practice, and how that might be relevant in terms of those kind of, overlapping between health and social care, and obviously the third sector.
Joe, do you want to speak about this, or do you want me to? Sadly, we don't have Becky on the call. She'd be absolutely perfect to talk about this.
Okay.
So I know that it's a really Newfield Medical Group is a really unusual example. So they set up as a cooperative, and it was kind of it was. I think that they're unique, actually. I don't know whether there's another cooperative GP surgery in Scotland. And really, it was to try and increase flexibility. So it allowed them to do things in different ways that they just simply wouldn't have been able to do if they were a NHS GP practice. And be able to set up things like this charitable arm that Joe's looking after, essentially. So it's their governance, I think, that's their governance structure that's allowed them to do that. And I will stick a little piece. There was a really good article that Becky wrote about how they got to the point where they became a cooperative, and I'll stick that in the chat so you can have a wee look at that. But
Great,
Joe, I don't know
thank
whether
you.
you've got anything else to add about that, or you're much closer than me.
Sorry, I was just trying to unmute myself. I think you've got it there. I think, if they were to do, I think that was, I think the main reason for the charity to be set up was to allow them sort of things to happen. I think if it was the GP practice sort of doing that under that sort of wing, I think there would have obviously had to be a lot more governance, a lot more strategic input, all that kind of stuff from the directors. Whereas, as our charity, we do have like our own set of trustees and all that. So yeah, I think hopefully that answers with Kathy's part and my part as well.
That's great, thank you.
So are there any other questions? Any other thoughts? Alison, do you want to ask, or do you want me to ask on your behalf? Alison Lean. So Alison says, hi, I work for an organisation called Abused Men in Scotland. I know of Abused Men in Scotland. And I was just wondering what, if any, support is provided to dads who have or are experiencing domestic abuse in the Tayside area. So actually, I'm just wondering, Fiona, do you know of anything? Fiona Harrow?
There's Andy's Man's Club, which is run from the Boomerang Centre. They do a group on, I think it's a Monday evening. I can't think of any place else. If he's a dad, though, I can work with him. So.
And Joe, do you know any other organisations that might help abused men?
Off the top of my head, no, I don't actually. Andy's Man's Club was one of the ones that came to mind as well, but I'm not sure there's many or any others really.
To be honest, I don't think there's any.
No, I don't think there is.
And Alison, I suppose actually that's a really good point, is that it's such a taboo area, to be honest with you, abused men. Obviously, there's a huge amount of stigma associated with men coming forward and there being support for men. Obviously, there's a huge focus on domestic abuse and women being the victims of abuse, but less so for men. So I think there's probably a way to go actually, that we're not supporting those men enough. I'm just wondering whether it's anything that comes up for you, Liam, when you're working with men, or actually Pam, just more widely in the work that you guys do.
I'd not have to refer anyone specifically for. Are we talking like domestic abuse, men involved in being?
Yes, so I suppose it could be physical
A
abuse,
victim
or
of
it could
domestic
be
abuse.
or kind of mental abuse more widely.
Nothing specific that I know of. I've not had to refer anyone on. No, but I'm sure there would be something available.
No, I think
if it's not local, maybe a bit further.
Pam, are you aware of anything else?
Not particularly. In general terms, we're not like, this project is the main one we work with fathers, so yeah, we don't see it as much with this demographic.
Yeah. Well, I've realised now that we're slightly over, but thank you ever so much. And Colin, I'm so sorry that we didn't get onto you. It might be worth saying actually that Colin McFarlane's on the call today, and he's the reason why we started getting involved with YMCA Tayside at the start, and he could see how amazing Elevate Men was, what an amazing program it was that's been developed, and what a unique partnership YMCA Tayside had with Newfield. And I'm just wondering whether it's worth bringing you in very briefly. I know we're slightly over time, but just for you to have a final few words, if you're around, Colin.
Still around, Kathy. And so yeah, I work for YMCA Scotland, but I think the key, and it actually links with the point that's just been raised. A key piece of work that we're involved in at YMCA Scotland is the development of the Scottish Healthy Masculinity Alliance, which is a group of organisations who are looking to raise the profile of men's work and work with young men, work with all men, looking at tackling some of the challenges that are for men just now. We know that suicide's the biggest killer of young men in the UK. If you're under the age of 45, Scotland's a lot worse than England as well. So there's some really horrifying and quite challenging statistics out there that men are facing just now. And the point was just raised around around abused men. We don't know what projects are out there. We don't know what systems of care are out there. We don't know what opportunities are out there. So part of what the Scottish Healthy Masculinity Alliance is looking to do is to gather those types of information, gather research evidence and data from Scotland, the UK and worldwide on how best to support young men, because as I say, a lot of the statistics around men, and for me in our work around particularly young men, are really quite startling. We've got a very interesting, how do I say this, social challenge just now, in that lots of the rhetoric and talk about men is about toxic masculinity and challenging masculinity, and there's very little out there around actually the good and the positive factors that men bring into your communities. So yeah, that's a lot of what the Healthy Masculinity Alliance is looking to do. Anybody's interested, drop me a line, Colin at ymca.scot, and happy to take any of those conversations further.
Fantastic. And we'll make sure that we send an email out with not only the recording from this event so you can have a look, but also some the research that Jessica's been doing, and also some sort of cheat sheets if you want to support young men and young dads specifically a little better. We'll send that out. But I just want to say an absolute enormous thank you to all the participants from YMCA Tayside, from YMCA Scotland, Colin, from Newfield, from Dad's Rock, who've come on and taken time out for their day to present, and also for everybody else for coming along and staying with me for an extra 5 minutes. So thank you, everyone. Really appreciate it. I hope you found it useful.